Yesterday, we talked quickly about 3 pieces of legislation that have created the crux of the perfect storm for coronavirus. 1, we made it illegal for physicians to own hospitals. Imagine being a chef and you can't own your own restaurant. Now, somebody will say, well, it doesn't matter. Healthcare is not like cooking. But if the people that are responsible for the business aren't in charge of the business, what does that mean? Question, but you can watch yesterday's video. Number 2 piece of legislation we talk about, certificate of need. There are 35 states that limit competition, limit supply. I think all of us are in agreement that we could use more hospitals and more hospital beds today. True. Number 3, the 1997 Balanced Budget Act did a really good job balancing the budget. It capped the number of residents and the number of physicians. We could all agree that we need more physicians today. True? Yes, I know it is. That's why I'm saying it. Now, what I'm going to talk about today, how do physicians take back healthcare? How do nurse practitioners take back healthcare? How do PAs take back healthcare? Probably PAs can't take back healthcare because they're kind of last. But they play a vital role in the clinical healthcare system. We could not survive without those 3, and we certainly couldn't survive without the backbone of our healthcare system, which is nurses. It'd be good sometimes if, never mind, that's a topic for another day. Now, if you want to return healthcare to the rightful owners, the rightful stewards, this is how you do it. Physicians, there are now 3.5 to 3.7 million elective procedures stacked up. This is going to go on for another 2 months, maybe 3. And there's about 4.1 million elective procedures done a month. As these stack up, is it really a good idea to send them back to the health systems? I don't think so. I will work on the consultants, the brokers, the advisors who claim that they want to do what's in the best interest of the patients and the employer's dollar. Is it really wise to send elective cases into a hospital during coronavirus and certainly right after? Probably not. There are over 4,000 physician-owned ambulatory surgery centers and surgical hospitals that meet the very same criteria hospitals have to meet. The OR is no different. It's not worse, it's not bad, it's actually probably better. It's certainly safer. Hospital readmission rates for Medicare-age patients are 18 to 20%. Readmission rates for commercial payments in hospitals, commercial payers in hospitals, is somewhere close to 10 to 12. What is it in a private practice ambulatory surgery center model? 3, 4, at tops. What's the infection rate at a hospital and a health system? 3.5, 4, 5, somewhere as high as 7, 8. Do you really think it's a good idea to send patients to that type of environment? My friends, if you want to take back healthcare, this is for physicians and clinicians. If you want to take it back and you want to be the steward, send no cases to these hospital systems. 0, bupkis, none, nix, as I like to say in Dutch. The way that you take it back is by putting leverage onto the system. You are the frontline worker. You are the leverage. Look, they're happy to let private practice orthopedic offices go out of business or cardiology offices. The federal government's happy to let you go out of business. They're not going to lend you a hand. They'd rather just give Boeing, here's some credit facilities for you and for you, big business, and for you, big business. But they're happy to let private practices go out of business. It's time that you took charge and control. It's time that you win. Disintermediation occurs when a bunch of physicians and a bunch of clinicians own the healthcare system. Not insurance companies, not big business, not big not-for-profits owned by private equity. Now, don't hear me incorrectly. I'm not saying any of these people are nefarious. They could be, but I'm not saying that because I don't believe they are. They're doing in what's their best interest. And you, my friend, the good physician, have to do what's in your best interest and in the best interest of your patient. And generally, those two things are in alignment. Generally. There are bad actors in every situation. But I don't see a lot of that in the physician and clinician community. In fact, I see significantly less bad actors in that community. There are some that like to overbill. Sure, we'll take care of them. The way we take back healthcare, the way we make it affordable and accessible, is by returning it to the rightful stewards. Dutch Rojas out.